Welcome back to the deep dive. Okay, so you've handed us this interesting set of notes covering something, well, pretty much everyone goes through upper respiratory tract infections, or URTIs.
That's right. Very common stuff.
Yeah, so our mission today is basically to take this source material, this stack of notes, and really distill it. Think of this deep dive as your quick route to getting properly informed on URTIs.
hmm
We're going to pull out the essential knowledge, maybe some details you didn't expect, and, give you just enough context so it actually sticks.
Exactly. And URTIs are incredibly common. So getting a solid handle on the key facts from sources like these notes is, well, it's really valuable.
Definitely.
Whether you're kind of firming up what you already know or just need to get up to speed quickly, we're aiming to help you navigate this info efficiently.
So for you listening in, we're diving deep into these specific notes on URTIs. We'll cover everything from what they actually are, how your body reacts, who's most likely to get them, what symptoms to look out for. And there are some really crucial warning signs mentioned in here we need to touch on, plus how they're usually managed and, what the general outlook is.
It's all about making that dense info clear, memorable.
Turning it into insights you can actually recall. Ready?
Let's do it.
Okay, let's unpack this right away. Based on these notes, what exactly is an upper respiratory tract infection?
So, according to the notes, it's not just one single illness. It's actually a group of infections. They target the upper part of your respiratory system.
Okay, so specifically,
We're talking the nose, the throat, the sinuses, and the larynx, the voice box.
right, so things we'd all recognize immediately then, like the common cold, sinusitis,
hmm
a sore throat, laryngitis. Those all fall under the URTI umbrella according to this material.
Exactly. Those are the classic examples listed. And the notes do highlight something important. While anyone can get them, they're particularly common in infants and the elderly.
Okay, good point. And thankfully, the notes also say they're usually self-limiting.
Yes, that's a key feature mentioned. They tend to clear up on their own, often within, say, about 10 days or so.
That's reassuring.
That's the typical picture, yeah. But the material does flag a couple of rare but quite serious potential complications that you really need to have on your radar.
Okay, like what?
Well, severe infections caused by a bacterium called Streptococcus pyogenes.
Hmm.
In, very rare instances, these can lead to conditions like rheumatic fever or glomerulonephritis,
Wow, okay.
and also influenza. The flu can cause complications, especially for people who already have underlying chronic lung conditions or other significant health issues, comorbidities.
So, takeaway number one from the notes, URTIs are a category. They hit specific areas. Most get better on their own pretty quickly, but you've got to be aware of those rare but serious exceptions. That sets the stage, right?
Absolutely. It gives us the essential foundation for everything else.
All right, so digging a bit deeper, what's actually causing these infections? What do the notes say about the culprits behind URTIs?
The sources are quite clear here. The main causes are primarily viruses or bacteria.
Okay. And the list of viruses, well, it looks like a familiar lineup, doesn't it? Rhinovirus, coronavirus, which we all know way too much about now.
Ah, indeed.
Influenza virus, adenovirus, and respiratory syncytial virus, RSV.
Yes, and RSV is specifically called out in the material in the context of children.
Hmm.
On the bacterial side, the main one mentioned is Streptococcus pyogenes.
The same one linked to those rare complications.
That's the one. And the notes specifically link it to cases of tonsillitis or sinusitis.
And, figuring out if it's viral or bacterial, that's going to be super important later when we get to treatment. Right.
Precisely. The cause, as outlined in the notes, directly shapes the management approach.
Okay, moving on then. Who is most likely to get hit by an URTI? Based on these notes, what puts someone at higher risk?
So the notes list several key risk factors. A weakened immune system is a big one, whether that's due to age, like the infants and elderly we mentioned before, or chronic illness, or even certain medications that suppress the immune system.
Makes sense. If your body's defenses are a bit down, you're, well, an easier target.
Exactly. Close contact with infected individuals is another major factor listed.
So, like crowded places, schools, public transport, or just being at home with someone who's sick.
All of those increase your risk significantly. Poor hygiene practices are also mentioned, particularly things like not washing hands properly or often enough.
The simple stuff really counts then. It always comes back to hand washing.
It really does. And finally, the notes mention exposure to environmental irritants. Things like cigarette smoke, air pollution, or even allergens can make your respiratory tract more vulnerable to infection.
So when you list them out like that, these are all really common everyday things, aren't they? Which kind of explains why URTIs are just, well, everywhere.
It absolutely contributes to how widespread they are, yes.
Speaking of which, how do these tiny invaders actually get inside us and start causing problems? What's the process, the pathophysiology that the notes describe?
Well, the notes state that these infections mainly spread through respiratory droplets. When someone who's infected coughs or sneezes.
Those tiny invisible particles hang in the air or land on things.
Exactly. So you can either breathe them in directly, or you might touch a doorknob, a phone that's contaminated.
And then touch your face, eyes, nose, mouth.
That's the classic transmission route described. Once these pathogens, the viruses or bacteria, get past your body's initial defenses, they invade the respiratory mucosa. That's the delicate lining inside your nose, your throat.
Okay.
And this invasion triggers an inflammatory response from your immune system.
Ah, and that's the inflammation that causes all the misery, isn't it? The stuffy nose, the sore throat, the general yuck feeling.
That's exactly it. The development of those familiar URTI symptoms, we all know, is a direct result of your body's inflammatory reaction to that pathogen setting up shop in the mucosal lining.
Okay, right. So let's say someone has those symptoms, a cough, sore throat, feeling rough. Is it always a standard URTI? What do the notes say about other conditions that might look similar? The differential diagnoses.
Yeah, this is a really crucial section in the notes because symptoms definitely overlap between conditions. The notes list several important lookalikes.
Okay.
Allergic rhinitis is one that's triggered by allergens like pollen or dust mites, not an infection.
Right, like hay fever.
Exactly. And the symptoms are often a bit different. Lots of sneezing, a very clear runny nose, itchy eyes, and usually, importantly, no fever.
Got it. What else?
Asthma exacerbation is also mentioned. So this isn't an infection either. It's a worsening of underlying asthma.
Yeah.
Symptoms there are typically wheezing, feeling short of breath, chest tightness.
Different pattern again.
Yes. Then there's bronchitis. That's inflammation lower down in the bronchi, the larger airways. That usually involves a persistent cough, often bringing up mucus and maybe some chest discomfort.
And then I suppose the more serious possibility the notes mention is pneumonia.
Correct. Pneumonia is highlighted as an infection actually in the lungs. It's usually more severe than a typical URTI. You'd often see a higher fever, a deeper cough that produces phlegm, and sometimes chest pain.
And the notes just lump others together.
Yeah, they include a sort of catch-all category of other respiratory disorders, just to acknowledge there could be other things too.
So this is a really important nugget for anyone learning this stuff. Just because you've got a cough or a sore throat, it doesn't automatically mean it's a straightforward URTI. You really have to think about these other possibilities based on the whole symptom picture.
Absolutely. Being able to distinguish URTIs from these other conditions based on the clinical features is, well, it's fundamental for getting the diagnosis and the management right.
Okay, let's zoom out a bit now. Thinking about the bigger picture, how common are URTIs really? What does the epidemiology section of these notes tell us?
Oh, the notes are very clear on this. URTIs are extremely common.
Yeah.
Highly prevalent.
No surprise there.
None at all. And there's a definite seasonal pattern mentioned, with cases really spiking during the colder months.
Yeah, it always feels like everyone's got something going around in winter, doesn't it?
That's pretty much the reality reflected in the notes. And they specifically highlight the significant impact this has, particularly in the UK context.
How so?
Well, they state that URTIs are a major contributor to the overall burden of respiratory infections. And importantly, they're listed as a leading reason why people go to see their doctor.
Wow.
And also a primary cause for missed days from work or school across the UK.
Okay, so while they might feel like just a minor personal annoyance, when you look at it collectively, URTIs have this huge knock-on effect on, well, health services and the economy. That's actually quite a powerful insight from these notes.
It really underscores their prevalence and impact, yes.
All right, let's get down to the nitty-gritty. What you actually see and feel. What's the classic checklist of signs and symptoms for an URTI, according to these notes?
Okay, the notes provide a pretty comprehensive list. The common symptoms include nasal congestion, a runny nose, the medical term is rhinorrhea,
Right.
a sore throat, cough, sneezing, headache, fatigue, or tiredness, usually a mild fever. that general feeling of being unwell or out of sorts, which is called malaise, and sometimes painful swallowing. That's odynophagia.
Okay, that sounds like the typical rundown most of us have experienced. But the notes also point out some more specific things a doctor might look for, physical signs.
Yes, they do. They mention things like ear pain, that's otalgia, enlarged tonsils, which sometimes might have visible white spots or patches, that's exudate,
Okay.
and swollen glands, lymph nodes in the neck, that's cervical lymphadenopathy.
Right, and I think there was a detail mentioned about the cough, something that might give a clue about the cough.
Ah, yes. The notes mention that if the cough produces purulent phlegm, that thicker, often greenish or yellowish mucus, that could suggest that a bacterial infection might be involved rather than just a virus.
Okay, interesting. Now, this next part feels really important. The notes list some specific concerning signs, especially for some of the less common but potentially more severe URTIs, like diphtheria or acute epiglottitis. What should someone listening really pay attention to here? These sound like red flags.
Yes, this is absolutely a key nugget to take away from the notes. These are the warning signs.
Yeah.
Difficulty breathing, the term is dyspnoea. Excessive drooling, particularly in children, and a harsh, noisy sound when breathing in, which is called stridor.
Stridor, okay.
These signs point towards potential airway obstruction, which is a medical emergency. They need immediate medical attention.
Right. So the big takeaway here is most URTI symptoms are mild and familiar, but everyone needs to know those red flags. Real trouble breathing, lots of drilling, that specific noisy breathing sound, that's when it's serious.
Absolutely critical. Knowing those helps distinguish the mild self-limiting cases from the potentially severe ones needing urgent care.
Okay, so you've got the symptoms. Do you always need a battery of tests to confirm it's an URTI? What does the investigation section of the notes say about diagnosis?
Well, the notes state quite clearly that in the vast majority of cases, URTIs are diagnosed clinically. Meaning the doctor makes the diagnosis based on your symptoms, your history, and what they find during their examination.
So usually no tests needed for just a standard cold or sore throat then.
Generally, no.
When are tests used according to these notes?
Tests are typically reserved for specific situations, cases that are unusually severe or lasting much longer than expected, or where there's a strong suspicion of a particular complication or maybe one of those alternative diagnoses we talked about.
Okay, and what tests are listed?
The notes list several possibilities. A throat swab can be done to look for specific bacteria like Streptococcus.
For strep throat.
Exactly. A nasal swab can also be collected, and that sample can be used for testing for viruses or bacteria. Blood tests might be done, including a complete blood count or CBC, to look for general signs of infection.
And didn't the notes mention tests for specific viruses too, like glandular fever?
Yes, they specifically call out the monospot test and looking at a blood film under the microscope. These are used to check for Epstein-Barr virus, the cause of glandular fever or infectious mononucleosis. The blood film might show characteristic cells called atypical lymphocytes.
Right. And the chest x-ray we mentioned earlier in differentials.
That's listed too as an investigation specifically to diagnose pneumonia, which, remember, could be a complication of an URTI or could be the actual diagnosis instead of a URTI.
Okay.
But the notes emphasize that these tests aren't routine. They're used strategically to confirm a diagnosis or guide treatment when the clinical picture isn't straightforward or suggests something more serious is going on.
Got it. Tests are for clarification, not standard procedure. So if you do have an URTI, how do you actually get better? What's the management approach described in these UK-focused notes?
Okay, the primary approach outlined in the notes is what's called supportive management.
Supportive care, which basically means...
It's about supporting your body's own ability to fight off the infection and managing the symptoms to make you feel more comfortable while it does.
Makes sense.
So the notes list measures like getting plenty of rest that really does help your body recover.
Yeah.
Staying well hydrated, drinking lots of fluids, and using over-the-counter medications.
Ah, the things you buy at the chemist, like painkillers and fever reducers, ibuprofen, paracetamol.
Exactly those. They help with aches, pains, fever. And decongestants might be suggested for a blocked or stuffy nose. That's really the core strategy for most URTIs because, as we keep saying, most of them are caused by viruses.
And because most are viral, that brings us to the really big question in management: antibiotics. The notes definitely discuss antibiotic prescribing guidelines, right?
They do, and this is a critical point emphasized in the material. Antibiotics are explicitly stated as not being routinely prescribed for UTIs.
Because they don't work on viruses.
Precisely. They only target bacteria. So giving them for a viral cold or sore throat won't help you get better faster, and it contributes to antibiotic resistance, which is a huge problem.
So how do doctors decide when antibiotics might be needed? The notes mentioned criteria.
Yes, the notes mention using clinical criteria to help judge if a bacterial cause is likely, especially for sore throats. The center criteria are referenced.
Okay, center criteria. Let's see if I remember from the notes. Tonsillar exudate, those white spots.
Yes?
Fever. Absence of cough. And tender swollen glands in the neck, cervical lymphadenopathy.
That's them. Tonsillar exudate, fever, absence of cough, tender nodes, TFAT.
That absence of cough one is always the bit that feels counterintuitive, isn't it? You'd think a cough means infection warrants antibiotics, but for a sore throat, the lack of a cough actually makes a bacterial cause more likely according to this criteria. That's a really key nugget from the notes.
It is. It's a useful point, often surprising when you first learn it. The notes also list some other specific situations where antibiotics might be considered, or definitely indicated, even outside the center score.
Okay, what are those kind of higher risk scenarios?
Things like having a past history of rheumatic fever. If the person is clearly very unwell, systemically really knocked for six. If they're immunosuppressed for any reason.
Right.
If there's suspicion of those more serious conditions like acute epiglottitis or diphtheria. If someone with existing chronic lung disease develops bronchitis. For children who have infection in both middle ears, bilateral otitis media, and again, diphtheria is mentioned.
Okay, so basically antibiotics come into play if it seems likely bacterial based on criteria like Centaur, or if there are specific underlying risks or signs of a more severe or complicated infection.
That sums it up perfectly based on the notes. They also mention typical antibiotic courses are often 7 to 10 days long.
Any specific antibiotics mentioned?
Erythromycin is listed as an alternative if someone is allergic to penicillin. And there's a very specific point made about using phenoxymethylpenicillin if glandular fever is suspected not to treat the glandular fever itself, which is viral, but apparently to prevent a specific type of rash that can occur if other antibiotics, like amoxicillin, are mistakenly given.
Huh. That's a very specific clinical pearl. So the big overriding message from the management section seems crystal clear from these notes. Supportive care rest, fluids, symptom relief is the mainstay for most URTIs because they're viral. Antibiotics are reserved for confirmed or strongly suspected bacterial infections or specific high-risk situations guided by clinical criteria.
That is absolutely the essential takeaway on management according to the source material. Focus on symptom relief and immune support first.
So, assuming things go well, what's the usual outcome? What do the notes say about the prognosis for someone with an URTI?
The prognosis overall is generally described as favorable in the notes.
That's good news. And how long does recovery usually take?
Most individuals, the notes suggest, recover fully within about 1 to 2 weeks.
Okay.
But they do add the caveat that the exact duration and how severe the symptoms get can vary quite a bit. It depends on the specific virus or bacterium causing the infection. Simple cold versus influenza will feel different, and also on the individual's underlying health status.
Right. So generally good, things usually resolve, but it's not necessarily a guaranteed quick bounce back for absolutely everyone.
Exactly. There's some variability.
Now let's touch on the potential downsides again before we wrap up. What kind of complications are mentioned in these notes? What can actually go wrong, even if it's uncommon?
Yeah, the notes reiterate that complications are definitely uncommon, but they are possible.
And what are the main types listed?
The most frequent type of complication described is a secondary bacterial infection.
Okay, how does that happen?
Well, the initial viral infection can kind of weaken the body's defenses in the respiratory tract, making it easier for bacteria, which might already be hanging around, to take hold and cause a new infection on top of the viral one.
Ah, so you get a cold and then it turns into...
Exactly. Turns into bacterial sinusitis or otitis media, that's a bacterial middle ear infection, or bacterial bronchitis. Those are common examples given.
And can having an URTI make existing health problems worse?
Yes. The notes specifically list exacerbation of underlying respiratory conditions like asthma or COPD as a potential risk when someone gets an URTI.
Right, it can trigger a flare-up. And what about those more severe but thankfully rare issues we touched on earlier? Are they mentioned again here?
Yes, the notes briefly reiterate that rare but serious complications like pneumonia or even meningitis are possibilities, although again, not common outcomes of a typical URTI.
Okay, so the key point on complications seems to be, While most URTIs clear up just fine, it's important to be aware that things can occasionally go wrong, especially with those secondary bacterial infections setting in or existing conditions getting worse.
That awareness is crucial, yes. It helps in recognizing when things maybe aren't following that typical favorable course we expect.
Now, thinking about actually learning and revising this kind of medical information you mentioned in the brief, that having things like mnemonics, example questions, memory tips is really helpful for recall.
Oh, absolutely. Those kinds of tools, mnemonics, practice questions, spaced repetition, they are fantastic for really embedding knowledge and making sure you can retrieve it when you need it. Essential for revision.
Totally agree. We just need to make a point here for you, the listener. While the importance of those kinds of learning aids was highlighted in the context around this material, the actual notes we were given for this specific deep dive today, well, they didn't actually contain explicit examples of mnemonics or any practice questions or specific memory tips woven into the factual content about URTIs themselves.
Right. So while we absolutely recognize how valuable those tools are, especially for something like exam revision, we've had to stick strictly to the factual information that was present in the source notes we analyzed. We can't really discuss or generate specific mnemonics or questions that weren't provided in the material itself.
Exactly. We've covered everything that was detailed in the notes according to that outline.
We certainly have. We've gone through the definition, the causes, the risk factors, the pathophysiology, how these infections actually work. We looked at the differential diagnoses, what else it could be, the epidemiology, how common they are, the full rundown of clinical features, the symptoms and signs, including highlighting those really critical red flags, then how UTIs are investigated, the core principles of management, especially around antibiotics and supportive care, the typical prognosis or outlook, and finally, those potential, though uncommon, complications.
And we've done it by focusing on extracting those core nuggets, those key insights, directly from the material you shared with us. And hopefully understanding these fundamental aspects of URTIs cuts through some of the noise and gives you a solid, quickly recallable overview.
That's the goal, getting you informed efficiently and effectively based on the source.
So as we bring this deep dive to a close, here's maybe a final thought for you to consider, building on everything we've unpacked from these notes. Given just how incredibly common URTIs are, I mean, think about the sheer number of times you or people you know will experience symptoms. And given the spectrum we've discussed, from a totally benign common cold that just needs rest and fluids, all the way through to needing careful clinical judgment using criteria like Center for Potential Antibiotics, or even being hypervigilant for serious warning signs like stridor. How might this comprehensive overview, based strictly on the information in these notes, change the way you think about or perhaps approach just a sore throat or just a cold the next time it crops up?
It definitely adds a layer of informed perspective to what feels like a very everyday experience, doesn't it?
It really does. Well, thank you for bringing us this material and for joining us today for this deep dive into upper respiratory tract infections.
It was my pleasure.
If you found this deep dive helpful for getting your head around how to approach revising topics like this from source notes, you might want to check out pastthemsra.com.
And for more free revision resources and materials, do visit freemsra.com.
We'll catch you on the next deep dive.